Most people think that ACL tears automatically mean surgery, but recent studies show that this is not always true. Some people can function just fine, even returning to sports. However, this non-surgical approach isn't for everyone, and certain criteria must be met for success. But whether you're looking to avoid surgery or prepare your body for the operation, I'll provide key insights to help you achieve long-term success after ACL injury. ACL surgery has long been the go-to option for this type of injury, focusing on restoring stability by reconstructing the ligament. But recent research highlights that this surgery may not be always necessary. Some people with ACL injuries can be classified as copers, individuals who can effectively function without an ACL. Studies have shown that many people return to their pre-injury levels of sport without ACL reconstruction. Research also indicates no significant differences in outcomes between patients who underwent ACL reconstruction and those who pursued non-operative management over a 5-year period, with no significant differences in reported pain, instability, function, or signs of arthritis. On the other hand, there are groups of people who experience persistent knee instability and do require surgical management to restore knee function. These individuals are known as non-copers. But why do some people continue to experience instability while others seem to manage just fine? The ACL serves as a static stabilizer, offering consistent knee support. However, some individuals can compensate for a torn ACL using their muscles, which provide dynamic stability. These muscles actively engage to stabilize and support the knee during movement. So even without the primary static support of the ACL, these individuals can train their muscles to assume its stabilizing role, enabling them to maintain knee stability and pursue their activities without major issues. This ability to adapt and compensate is what separates copers from non-copers. Copers have the strength, balance, and muscle control to stabilize their knee dynamically, even without an ACL. So how do you identify if you're a coper or not? Well, researchers have developed a screening process to identify those who may be able to pursue non-surgical management. Before you can even participate in the screening process, though, you need to meet a few criteria. The first being that the injury must be an isolated ACL tear, without significant meniscus tears or other knee ligament injuries. Additional injuries can complicate healing and require different treatments. You must have full, pain-free knee range of motion and no joint swelling. This indicates that the initial inflammatory response to the injury has subsided, and your knee is in a stable condition suitable for further evaluation and rehabilitation. You must have regained at least 70% of the strength compared to the uninjured knee. This strength measurement is necessary as it demonstrates that your muscles are sufficiently strong to perform the more intensive testing that will come with determining if you're a coper or not. Now, the time to meet these criteria can vary, typically ranging from 2 to 6 weeks after injury. Once achieved, you're ready to assess your coping ability, which involves meeting all 4 of the following requirements. Number 1, a timed hop score greater than or equal to 80%. This test involves hopping on one leg over a distance of 6 meters, or about 20 feet, as fast as you can. This test allows for the assessment of your ability to stabilize the knee during a dynamic movement. The goal is to have less than 20% time difference between your injured and uninjured legs. This test is typically performed wearing a functional knee brace to provide stability. Number 2, a knee outcome survey score of greater than or equal to 80%. This survey measures how well you think you can perform everyday activities despite your knee injury. Scoring at least 80% indicates you can perform most daily activities without significant difficulty. I provided a link to the knee outcome survey in the description. Number 3, a global rating score of greater than or equal to 60%. This score reflects your overall opinion on your knee's function. On a scale of 0 to 100, where 0 means your knee is completely non-functional and 100 means it's back to your normal, you need to rate your knee at 60% or higher. And number 4, no more than 1 instance of knee giving way. You need to experience 1 or fewer instances where your knee gives out or shifts since the time of injury. More instances suggest greater instability of the knee. Patients who do not meet the threshold on any of these 4 criteria are considered non-copers and are referred back to their orthopedic surgeon to discuss surgical management. But those who pass these requirements are candidates for non-surgical ACL rehab. Now, passing these criteria suggests that you can cope without an ACL for most activities, but returning to high-impact sports is a different challenge. If you aim to return to sports, you should score greater than 90% on strength and hop tests compared to the non-injured knee, but getting closer to 95% for higher impact and quick pivoting sports is preferred. At the completion of physical therapy, individuals must be able to resume full participation in high-level sporting activities for a full year to be considered a true coper. But what's interesting is that even those who are not initially classified as a coper still have the potential to manage without surgery. A study has shown that almost half of the initial non-copers became potential copers after just 8 weeks of structured rehab, focusing on dynamic knee control and strength exercises. After a year of rehab, this number increased even further to 70%. So many people with ACL tears might not actually need surgery with a properly designed exercise program, even if they are deemed a non-coper early after injury. But even if you do plan on having surgery, don't skip out on pre-surgical rehab. Research suggests that rehab before surgery has major benefits. Athletes with good dynamic knee control and strength before surgery had a 2.9 times higher chance of success, even if the knee was giving out prior to surgery. This highlights the importance of strengthening your leg muscles for long-term success, whether you opt for surgery or not. Now, what does non-surgical rehab look like for ACL tears? Well, it can be broken up into 4 main phases, with each phase building upon the previous one, allowing for a comprehensive rehabilitation process that maximizes recovery and minimizes the risk of re-injury. Phase 1 begins immediately after injury, focusing on reducing pain, swelling, and restoring knee range of motion while gradually normalizing everyday movement. Basic balance exercises and strengthening exercises are introduced to prevent muscle deconditioning and start restoring knee stability, usually beginning with double leg strength exercises and progressing to single leg. Weight is typically between 65 to 75% of a 1 repetition maximum, with sets and reps consisting of 3 sets of 10 to 15 repetitions to restore muscular control and endurance. By the end of phase 1, you should be able to walk and squat normally without significant discomfort, and daily activity should be manageable with minimal to no pain and swelling. You should also demonstrate at least 85% strength on the injured leg compared to the non-injured side, along with good balance on stable surfaces. Phase 2 increases the challenge level of exercises by incorporating progressively heavier weights and dynamic balance activities. Sets and reps are adjusted to 3 sets of 6 to 8 reps, with weight working upwards between 80 to 85% of a 1 repetition maximum in order to regain strength and power. This phase introduces movements and exercises designed to challenge your balance and train your body's ability to stabilize itself in unpredictable situations. Jumping and controlled jogging or sprinting are gradually introduced as tolerated, focusing on controlled movements to avoid re-injury. By the end of phase 2, you should achieve over 90% strength and hop test scores on the injured leg compared to the non-injured side. This phase prepares you for dynamic activities and ensures that your knee can handle higher demands. Phase 3 emphasizes speed, power, and agility, with specific drills that simulate movements relevant to your desired sport or activity. The focus shifts to enhancing explosive power and agility while maintaining knee stability and control. Exercises in this phase are designed to replicate the demands of your sport, ensuring that you can safely return to competitive or high-level activities. Progressive strengthening continues, but the primary goal is to enhance performance-specific capabilities and ensure readiness for full sports participation. By the end of phase 3, you should score over 95% strength and hop test scores on the injured leg compared to the non-injured side. This will ensure you have adequate strength and control for when you start to play. Phase 4 is the final stage, focusing now on participating in controlled sport drills. This phase involves intensive training that mirrors the exact demands of your sport, ensuring that your knee can handle the stress and intensity of competitive play. Sports-simulated agility and reaction drills are emphasized to ensure that you regain full functionality and confidence in your knee. Continuous assessment and adjustment of exercises are crucial to address any lingering weakness or imbalances. By the end of phase 4, you should be ready to safely and effectively return to competition with reduced risk of re-injury. The current best practice for non-surgical ACL management recommends physical therapy for at least 3 to 4 months after injury. This allows for sufficient time to progress through the full continuum of rehab, with an emphasis on progressive stability training combined with agility and strengthening exercises. So based on the current research, non-operative management of ACL injuries can be an effective option for some individuals, even those returning to sports. Generally, those over the age age of 18, including those participating in pivoting sports like soccer and basketball, who have experienced their first ACL injury without significant damage to other parts of the knee, can be considered for non-operative management, as long-term outcomes for these patients are often comparable to those who undergo early or delayed ACL surgery. What are your thoughts? Have you or someone you know experienced an ACL injury? I'd love to hear from you. Did you choose surgery or go the non-surgical route? Share your experiences and questions in the comments below. Your stories can help others in our community make informed decisions. Wondering which ACL graft is the best option for you? Well, check out this next video where we take a deep evidence-based dive into ACL grafts. And thank you for watching this episode of Physio Show. You can support the channel by liking the video and subscribing to stay updated on everything you need to know about your body, how it works, and what it needs to keep moving.